Alright, welcome back to Steve Brine TV here at the Old Parsonage in Otterbourne, just outside Winchester. Andrew Lansley, Shadow Health Secretary. Brilliant to have you back in Winchester.
Great to be here again.
I'd love to see the van with NHS on the side. Now, we came here to talk to the residents of Old Parsonage Court today about all sorts of issues. They're asking about last night's debate.
Yes.
But one of the big issues on their mind and on many of the constituents that I hope to represent is the issue of long-term care. If you become Health Secretary in less than a week's time, what will we do?
Well, I think there's a number of things. First, the NHS needs to be there when people need it, because we can't have the sick pay for Labour's debt crisis. That's why we're committed to the NHS. But also, as people get older, of course, they quite often become more frail. Not always, but sometimes. So we do need to make sure that we can be there early, helping people with home adaptations, maybe putting in some telecare at home, but be sure that we're there, because actually it's much better to support people at home and help people to be independent than see them just become more dependent and have lots of people having to provide care. But then also, you know and I know that more than 13 years ago Tony Blair said he didn't want his children to live in a country where people had to sell their homes to pay for care. But 1,000 people a week are still doing that. So we will, through our home protection scheme, give people a real opportunity at an affordable premium to ensure that if they were to go into long-term residential care, they wouldn't have to sell their homes to pay for care, that everything would be paid for them. Now, of course, that is a partnership. It's people who have the assets and the income being in partnership with the government about making that happen. People who don't have assets and income, of course, social care should be, personal care for them, like healthcare, should be free. But the key principle is it takes away the absolute necessity of people having to sell their home to pay for care when they need it. Yeah, because actually at the moment it is shocking, what is in effect a lottery. 1 in 5 people go into long-term residential care, and of those there's nearly 50,000 a year who end up selling their home, what they've lived in, saved for, thought they would hand on to their children, and they lose it all. And we do have to give people an opportunity to ensure that that will not happen to them. Yeah. Well, let's hope we have our chance to put it into practice. We'll do our best to deliver Winchester. Thanks for coming again. Thanks very much.